Hi, and welcome to this video on movement at joints. We'll do a little bit of linking of muscles as well. So first, let's look at the upper body and we're going to look at the elbow joint. So the elbow joint, when your bicep contracts, you get flexion. And when your tricep contracts, you get the opposite movement, you get extension. That's an antagonistic muscle pair. You can check out the video for that another time. So let's look at the shoulder joint now. So the first movement we look at is flexion. So her pectorals are bringing her arm across in front of her body, creating flexion at the shoulder. And extension is the opposite direction, going backwards, almost around the back. Also at the shoulder joint, we have abduction and adduction. So abduction is away, and adduction is back to the middle point of the body. Now also, in our lower arm, where our radius and ulna meet, the two bones in our lower arm, we can get rotation. So we can get a slight twisting of the lower arm, which doesn't move the shoulder joint. The shoulder joint, we can get circumduction, where your shoulder can go round in a circle. You could be doing front crawl or cricket bowling in action, or backwards in the same action. We also call that circumduction. The other thing your shoulder joint can do, it can do some rotation. So it's turning slightly at the shoulder joint to create that. Now, when we talk about rotation, we're drawing a dot, and circumduction, we're drawing a huge circle. Let's look at the movements of the lower body now. Let's look at the hip first. So the first one we've got flexion. So your hip flexors lift your upper leg towards your abdominal area, your stomach. They can also extend at the hip, going backwards, maybe almost like you're doing a backstroke kick. Also, we have abduction and adduction. So again, abduction away from the body, adduction back to the midline, a bit like a breaststroke kick. And rotation at our hip, so you can create a little bit of twisting. If you're going to track the ball in football or control the ball, you turn out using rotation. Circumduction is also possible at the hip, so a circular action is possible, and the leg can draw a large circle, not as large as the shoulder can. We'd see this in breaststroke, leg kick, turning and gymnastics. Let's look at the knee now. So at the knee we can have flexion and extension. So we can see that's kind of a kicking action, whether that's football or front crawl kicking action. So in our ankle joint, what we have, we can create plantar flexion and dorsiflexion. So plantar flexion is a pointing of the toes. So it could be the last part of a jump or going up onto our toes. And dorsiflexion is the opposite, it's lifting the toe towards the knee. Wrist joint, now it doesn't come up very often in the exams, but there are movements that can be created at the wrist. So we have flexion, so we bring our hand forwards, and extension, we take our hand backwards. We also have abduction, where your thumb goes out to the side, and adduction, where your little finger comes towards your body. So the neck joint. So the neck joint allows rotation, not full all the way around, but part from side to side. Okay? So all that's happening there is the top two joints of your vertebrae allowing your head to rotate side to side. You'd use this maybe when taking a breath in front crawl.
I hope you found this video useful. Go and check out the other ones on PE revision, and also have ones on exam questions too. Good luck.